I've long been a believer in getting regular blood work done.
Wrong, 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 wrong.
For the simple reason that many of the factors that impact your immediate and long-term health can only be analyzed from a quality blood test.
You're wrong. All these influencers are pushing blood tests to optimize your health. But what if there's a fundamental flaw in their advice? Imagine you go get your blood checked, you get the results, but how do you know whether your levels are optimal? Let's start with a simple example, hemoglobin, which is the molecule that carries oxygen to all the tissues in your body. So, important stuff, right? And let's see if we can find the optimal level. If your hemoglobin is too high, you're at higher risk for blood clots, which can be fatal. And if your hemoglobin is too low, your tissues may not get enough oxygen. So you may have fatigue, weakness, shortness of breath, poor athletic performance, or in extreme cases, organ injury. But how do we know what's too high and what's too low? Well, to develop the normal range, we just took blood from people who reported no symptoms, just generally healthy people, and looked at their hemoglobin levels, and we found they fall on a bell curve. And we said, well, if you're between the 5th percentile and 95th percentile on this bell curve, that is plus or minus 2 standard deviations, we'll call that normal. Anything below or above that is going to be declared abnormal. Now, the problem, of course, is that we know that women usually have a lower blood count than men. So then we created different bell curves by looking at women and men separately. So for women, the range of normal is from 12 to 15, and for men, it's from 13 to 17, plus or minus, depending on the lab. So if I tell you that a patient had a hemoglobin level of 16, you have no idea if that's normal or abnormal, and no idea if this person is in any increased risk of blood clots or not, unless you know whether it's a man or a woman. But of course, when women get pregnant, the normal blood count varies by trimester, so we can segment that out into different bell curves for the first trimester, second trimester, third trimester, and those will be our normals. We also know that your hemoglobin can change according to your activities. If you go train at high altitudes where there's less oxygen, your body will react to the low oxygen by making more blood, so your blood count will be higher. Similarly, if you have sleep apnea, then you'll have times at night when your body isn't getting enough oxygen, and your body will react exactly the same way by making more blood, giving you a higher blood count. But at normal altitudes, when you exercise at high intensity, your body pushes fluid into your muscles, which makes your blood concentrated and thicker so it doesn't flow as easily. If you do that consistently over time, your body adapts by having you retain more fluid so that when you exercise, your blood will still flow easily. But when you're not exercising, that retained fluid is diluting your blood, making your hemoglobin concentration seem low, as if you have an anemia, which is called athletic pseudoanemia. But the athletes who train at high altitudes are doing that to improve their performance at normal altitudes. So correcting their high hemoglobin levels would undo the exact thing they were going for. In fact, they are deliberately increasing their risk of blood clots in order to increase their race performance. So optimum for them is defined by race time, not risk of death. The patients with sleep apnea genuinely aren't getting enough oxygen, so correcting their elevated hemoglobin level without correcting the apnea puts them at risk of organ failure from low oxygen levels. And the patient with the athletic pseudoanemia, where the hemoglobin is low, is actually healthier and better adapted than if his hemoglobin levels were normal. That's totally different than if someone has low hemoglobin levels because they have colon cancer and that tumor is slowly bleeding internally. So then, what is the optimum level of hemoglobin? And of course, now we have to ask, optimum for what? What do you mean by optimum? After all, iron supplementation can increase athletic performance, but it also appears to reduce longevity. So what's the optimum level? So then you think, well, maybe the problem is that we need more individualized labs. Just like there are different normal levels for pregnant women, maybe we need to personalize these labs more. But you rapidly run into a problem there as well. Should we have different normal ranges for endurance athletes, for weightlifters? Should people who live in Denver have a different normal range than those who live at sea level? And what if you start combining these factors? What about CrossFit athletes who do a mix of endurance and weightlifting? What if you take a woman who is in her third trimester, who runs a 10K every 2 weeks, lives at an altitude a mile above sea level, but also has sleep apnea? What's her optimum hemoglobin level? And if you add in a few more factors like age, ethnicity, or nutrition, pretty soon you end up with a group of one person, so the concept of normal is entirely gone, and everyone's blood count is optimum because there's nothing to compare to. So then you have to go back to what we said before, using a definition of optimum that's defined by an outcome instead of a comparison to a group, like race time instead of comparing to these normals. but then you'd need some sort of placebo-controlled trial to test whether changing the hemoglobin level actually improve the outcome. And you could do something like that for race time for an athlete, but you can't do that for longevity because we can't have you live multiple lifetimes at different hemoglobin levels and see which time you live the longest. We know from things like homocysteine and cholesterol that we can't judge the effect of adjusting one blood marker by looking at the effect of another blood marker. We have to actually measure longevity with longevity studies. So we would have to do a placebo-controlled trial, taking groups of people and somehow every day adjusting their hemoglobin level and then see who lived the longest. Not only is that incredibly far-fetched, but even then, wouldn't women have different results than men since their levels are naturally lower? And once again, you're right back to the segmentation comparison problem. I'm pointing out the flaws in this reasoning because this reasoning applies to everything from hemoglobin to insulin levels to testosterone. You fundamentally cannot use lab work for optimization. It cannot be done because it literally does not make any mathematical sense. Blood work is a tool designed to indicate if there is a chance of disease. If I see a low hemoglobin level, I'll ask the patient if they have any signs of bleeding like dark stools or heavier menstruation. I'll check their iron levels, B12 or thyroid levels to see if those are unusually low relative to the population. And if they are, I'll run an experiment by supplementing to see if the hemoglobin improves. If none of these things are true and the patient feels fine, I'll just assume that the low hemoglobin is normal for them. That may very well be their optimum. It may be an athletic pseudoanemia. We cannot optimize blood work because if there isn't a symptom or a problem, then any given lab value could already be the optimum for that patient in their context, whether it's high, low, or anywhere in between. And of course, there's a whole modern wellness industry that will capitalize on our cultural, nearly religious belief in the power of blood work. They will test you for 1,000 things, find the one where you're outside that bell curve of normal, and then tell you that that is a problem and that fixing it will optimize your health. And of course, they just so happen to have the supplement, diet, or protocol that will fix that blood level to whatever they are claiming is optimum. But in fact, just like the athlete with the pseudoanemia, that so-called suboptimal value may actually be more optimal for you. And that's an important bit, and I need you to soak that in because you may take a supplement or a diet or a protocol, you may get your value into the so-called optimum range, and you may in fact do worse because your abnormal lab may have been more optimum for your health. And of course, other than referring back to the blood work itself, these practitioners do not provide any real objective measure to prove that your health is more optimal. There's no true objective validation of their claims because then you'd see that it's all placebo. Any subjective experience, any feeling in any person is profoundly susceptible to the placebo effect. This is the modern health influencer combination that I call quantified quackery. We start with the false assurance of having a measurement to optimize, regardless of whether that number has been shown to be relevant in any way. We call that measurebation. And then we add the incorrect perception that improving the correlated lab must mean that longevity or well-being will be improved, which I call the biomarker bamboozle. Influencers then use slick graphics to share these falsehoods with patients who fool themselves into thinking that they would be able to tell the difference between a placebo effect and a real effect, which I call the placebo immunity illusion. This combination leads directly to patients chasing meaningless goals, taking time away from what they could really be doing, optimizing VO2 max, strength, social connectedness, and then refocusing on rigorously optimizing what really matters, the unmeasurable but critical true optimum, which is the depth and quality, the meaning and fulfillment of their experience of life. Blood work, just like MRI imaging, is fundamentally, irretrievably, and mathematically a tool for detecting disease and cannot be repurposed into a tool for optimizing health. If you want to understand more about blood work, check out this video in which I cover the biomarker bamboozle, homocysteine.